Hello, this is Professor Cahill from West Kentucky Community and Technical College, and I'd like to talk about a decision on whether or not to get the COVID-19 vaccination. Whenever we make a decision, we have to base our decision on facts. We have to weigh the pros and cons of that decision. And so when we look at some of the risks of getting COVID-19, you could be out of school or work for perhaps up to weeks of time. There's something that's called long COVID, where you can be sick for several weeks or months. From COVID, you could be hospitalized. Not only is this a problem for you directly, but you're also taking up the resources of a hospital, the staff, the doctors, the equipment, and even a bed. And in many places throughout the nation, hospitals are overfull with people who are sick from COVID, and they're having to turn away patients that are sick from other things. A lot of students and young people feel that they would not become very sick from COVID-19. And while this is true that the vast majority of young people are not becoming overly sick from COVID-19, the odds of you passing it on to somebody else and potentially making someone very sick or even dying are pretty high. You yourself could die, but you could pass the disease on to somebody else who's more susceptible and they could die. So these are all risks that we run if we get COVID-19. We, however, have hesitations about getting the vaccine. Getting a shot is painful and nobody likes getting a shot. Some of us have been told that this vaccine is unsafe or untested. We may not be sure of what's in it. Maybe it doesn't work at all. Maybe COVID isn't all that dangerous. Maybe I won't get COVID. Maybe I have already had COVID and I'm immune to it. These are all some hesitations that may prevent us from getting the vaccine. I would like to start by looking at Johns Hopkins Hospital and Medical School. And the reason that I'm using Johns Hopkins as a resource is they don't make money off of the vaccines. They're not involved in producing or selling the vaccines. They're not part of the government. They don't have a political agenda of any kind. And they're not part of the media, so they don't have a need to sensationalize any stories. These are doctors and nurses, not unlike your doctor that you see. And here's a statement from their website that I have here for you to check out if you'd like to. All 3 vaccines authorized or approved by the Food and Drug Administration have been thoroughly tested and found to be safe and effective in preventing severe COVID-19. They continue to undergo continuous and intense safety monitoring. Sometimes we ask ourselves whether or not COVID is all that big of a problem, and here are some statistics to illustrate whether or not COVID is a problem. Of all of the countries of the world, the United States is the 14th highest in terms of number of people with COVID-19. Within the United States, Kentucky was ranked 3rd highest, and here I have some gold boxes looking at some of these statistics. When we want to know just how many people have COVID-19, it's not good enough to simply look at the total number of people, because then it's hard to compare places like the country of China to the state of Kentucky, or perhaps the United States compared to Paducah. Communities of different sizes are, of course, going to have different populations. So instead, epidemiologists use the cases per 100,000 as their standard way of measuring the rates of COVID-19. And we can see that 50 out of every 100,000 people in the United States are sick with COVID. Whereas in Kentucky, we are at 96, or at least we were on the 3rd. Hospitalization, Kentucky has 51 per 100,000, which is higher than the national average, and the number of deaths is 0.52 compared to 0.56 per 100,000. So you can see that here in our community, the pandemic continues and rages on. To get an idea of how deadly this is, we can look at COVID has been around for the last 21 months, and 658,000 people have died from COVID. We can compare that to the Civil War, America's bloodiest war, which killed roughly the same number of people over 4 years of time. A paper from Baylor University, which I have linked to here, stated that smallpox in the 18th century was killing less people per year. Smallpox is a notoriously deadly virus which killed many people, but was killing fewer people than COVID-19. So back again to Johns Hopkins Medical School, and it states, doctors and scientists are working to estimate the mortality rate of COVID-19, but at present it is thought to be substantially higher, possibly 10 times higher than the flu. When you hear people compare COVID-19 to the flu, you need to keep in mind that the flu is a deadly virus. It kills many people every year worldwide, and COVID is 10 times more deadly than this deadly virus, the flu. So yes, this is a deadly disease, and it is a pandemic. When we go to get our vaccine, a lot of times we say to ourselves, but I don't know what's in it. I don't know what's in it. And the answer to that could be, well, the FDA has approved it, and it has been taken by many people. These same questions and answers can be said about things that we find in the grocery store. So if you think about it, many of the items that we buy in the grocery store, we have to take the word of the FDA and trust them that the things that are in these foods are safe to eat. Do we really know what's in Monster Energy drink? If we read the label on the back, there may be many confusing things listed as ingredients. This particular sandwich here, all of the processed and packaged foods have ingredients that have been tested and approved by the FDA, and we trust those. It only makes sense that if we trust the foods that we eat in the grocery store, that we should trust that same institution with the test of the vaccine. A lot of times when we look at the ingredients of things, including the vaccine, it can be quite scary. You may have been introduced to dihydrogen monoxide. Dihydrogen monoxide has many bad facts related to it. For example, cancerous tumors contain large fractions of dihydrogen monoxide. Dihydrogen monoxide is the most common chemical food additive and can be lethal in large doses. All serial killers have admitted to use dihydrogen monoxide. Now, of course, this is kind of a mean-spirited joke because dihydrogen monoxide is H2O, or water. And all of these things are, in fact, true about water. You can drown in water. You can drink so much water that it causes illness and has killed people. So all of these facts are painting a common, everyday item necessary for life as dangerous. We can flip the script, however. And so this is from the University of Cincinnati. It's a hospital and university, a medical school. And they have looked at the ingredients found in the vaccine and made them more friendly by comparing them to things that we have in everyday life. There are fats and oils, just like the fats and oils found in an avocado in this vaccine. There are acid stabilizers that are the same found in fruits. There are salt stabilizers, like table salt. And there are sugar stabilizers, like found in fructose. When we see words like mRNA or messenger ribonucleic acid or lipid nanoparticles, these words can seem really scary. But every one of your cells has many, countless molecules of mRNA within them. From head to toe, every single one of your cells has this messenger RNA. And these lipid nanoparticles are no different than the fats that we find in every one of our cells. So, when you take a look at some of the ingredients in Monster Energy Drink, do we know what all of these things are? We have to take the word of scientists at the FDA that these things are, in fact, safe for us. The vaccines have all been tested, and this is one example of a scientific clinical research test that was done on one of the vaccines. This is for the Moderna vaccine. And the Moderna vaccine, in its phase 3 FDA trial, looked at over 30,000 people to see whether or not the vaccine was effective and whether or not the vaccine was safe. They had a group that received the vaccine, a group that received a placebo shot, and it turns out that the number of people in the treatment group that received the vaccine had 11 cases of COVID. Now this is out of 15,000 people and 11 cases of COVID. But let's compare that to the control group that had roughly the same number of people. That group had 185 people who had symptomatic COVID, and 30 of them had to go to the hospital. This equates to a 94% efficacy rate. And overall, the safety was impeccable for this vaccine. And it continues to be tested to this day. This is data recently from the Centers of Disease Control, and these vaccines continue to this day to be effective against the new Delta variant. So the Delta variant is more likely to infect you and more transmissible, as well as causing more people to go to the hospital, but yet the vaccines are still continuing to fight off this Delta variant very effectively. Here's a statement about fertility from the Centers of Disease Control, and they recommend vaccination is recommended for everyone 12 years of age and older, including people who are trying to get pregnant now or might become pregnant in the future, as well as their partners. This is based on multiple studies of safety of these vaccines. So let's do a balancing act for this. There is no evidence that the vaccines cause complications with fertility, pregnancy, or breastfeeding. But on the other hand, pregnant people are at a higher risk for severe disease, complications, and death from COVID-19. You're running the risk of losing yourself and your unborn child by getting COVID-19. And on the other hand, there is no evidence that it causes problems with fertility, pregnancy, or breastfeeding. So a decision that we have to make. Also, these vaccines have been shown to have an increased chance of a condition called myocarditis or pericarditis. The mRNA vaccines, particularly in young men, have a very tiny fraction of people who become sick with myocarditis or pericarditis. These are inflammation of heart muscles and the lining of your heart. However, you're much more likely to get these conditions from COVID-19. So COVID-19 is far more likely to give you these conditions than the vaccine. These are decisions that we have to make, a balancing act of pros and cons. The Johnson & Johnson vaccine has been shown to increase the likelihood of blood clots, particularly in young women that are taking a particular kind of birth control pill. So, fortunately for us, we have the option of getting any one of the 3 different vaccines from Pfizer or Moderna or Johnson & Johnson. And if you are a young female and you are taking birth control, you will be advised to take one of the other vaccines because they are not related to these blood clots. So, increased blood clots can be avoided by taking a different vaccine. A lot of times people think that they may have been sick, or they have their antibodies checked, or they know by a positive COVID test that they have been sick with COVID already. However, the natural infection of COVID produces a different kind of antibody than those that are produced by the vaccine. Studies have shown that people who are vaccinated are better protected than those who have been sick by natural infection. It is likely that they will be protected for a longer period of time. And in fact, if you have been sick and have been vaccinated, you have the greatest chance of not getting sick. Your safety is increased if you have been sick and you have the vaccine over the vaccine alone, over being sick and not being vaccinated. So it's not clear whether or not antibodies produced by natural infection or the vaccine are better. At least we don't know for sure right now. And the adverse events caused by the vaccine are much, much more rare than those caused by the vaccine. So if we're running the risk of getting sick and saying to ourselves, well, maybe I don't need to get the vaccine because maybe I won't get sick at all. Remember the risks of COVID. Long COVID, hospitalization, death, spreading the virus to other people, and perhaps killing someone else. Also, let's think about this for a minute. If I'm sick and I pass this virus on to somebody else, I'm increasing the chances that a new and more deadly strain will come along. One that can bypass all the vaccines that we have now and start a whole new pandemic. These are things that we have to take into consideration. These are the pros and cons. These are the things that we need to weigh before we make our decision. So whenever someone tells you something, as a matter of fact, it is important for you to know where they got their information. So here are some of the sources that I used and the links. If you'd like to pause, you can copy these down and direct yourself to these different websites to see for yourself. And I thank you for your time.